Tell me a little bit about, this was a kind of another unique study that which took patients with poor performance status. So as we know, in solid tumors, most of the clinical trials, they need to have something called a performance status 0, 1. They need to be fairly functional, able to do the activities of daily living, get around the house, go shopping, things like that. But in this trial, you included a number of patients who were doing much more poorly than that.
Yeah, so I think that the FDA recognized at least from the initial phase 1 data, the kind of the incredible activity that this drug had in patients who had NTRK fusion, and allowed for a little bit more lax criteria in the context of enrolling patients both in the phase 2 trial and I think also and also the pediatric study, given the unmet need. We did not put a whole lot of patients with ECOG3 on this trial, to be frank.
Can you explain to me what is ECOG3 again?
ECOG3 just means, based upon the performance status, functionality, the criteria that, patients who are probably bedbound more than 50% of the day.
So not very functional at all.
Not very functional.
Can probably get around the house, do a few things, but mostly try to spend time in a bed or a chair or a couch or something.
Correct. And
so I'll tell you on the weekends I do that too. No? 50% of the time. But
we did enroll a handful of these patients who had ECOG3 that we identified with NTRK fusion. One patient I remember who was fairly debilitated was in the hospital actually for pain, severe pain management, and was on oxygen. We were able to get her enrolled on a trial, and even though she was in ECOG3, and start her on Larotrectinib, and she literally walked out of the hospital off of oxygen, pain-free, within a week after starting the drug, and still is on study almost a year and a half later as a hairdresser. And that's a
unique good hair.
That's a unique case, but what's really fascinating about this drug, and I think perhaps TRK inhibitors in general, is just the dramatic responses that we've seen with these patients who receive it. The first patient who actually received this drug was a young mom of 3 with sarcoma who had failed all known standard chemotherapy and had significant lung metastasis and was on oxygen and went on Larotrectinib, and within the first restaging had a near complete response and still remains on study almost over 3 years later. And that is also, I think, what's very interesting about this drug, or perhaps class of drugs. I would argue more so the Larotrectinib, but it seems like these patients really have a durable response for a fair long period of time, more so than other kinase inhibitors or small molecule inhibitors in general. And that may just be the biology of these tumors, right? Mm-hmm. Or it's not entirely clear, but it may just be the biology of the tumors. But these patients do seem to have very good responses that are very durable.
Durable to them. Now tell me how fast have you seen this response? You just talked about right now, but in general, when you look at the patients and everything, is it first restaging? It's about 2 months, most of those trials have. But how fast, when do you start, and when do you say, okay, this is probably not working or this is working? Like, what's the average when you've looked at all the patients?
So the average is usually the first duration, kind of about around 2 months is, as when that first restaging comes, is the vast majority of patients who are going to usually respond in that first restaging. But we have also seen, interesting, I had one mass tumor that did not have a partial response, but eventually developed into a almost near complete response 8 months out. And so some of these patients can continue to respond over months, but it's more common to see this dramatic response after the first restaging of these patients.
And clinically, do you see a response earlier? Like, do you see it in weeks, or does it take like a month? Like clinically, you're saying those patients of yours got off oxygen and everything. Normally, in the average, how often have you seen this?
Most of the clinical, whether it's pain or whether it's other symptoms, usually occur fairly dramatically. But there are other tumors, as I shared with you, the mass tumors that may not have a lot of associated clinical symptoms that they don't really notice, other than maybe some shrinkage in their lymph nodes or so forth, but can take a little bit longer for these patients to respond. But it is, and I mentioned this to some of my colleagues, if you've ever treated a patient with NTRK fusion with either Larotrectinib or NTRK or any of the TRK inhibitors, you want to screen everybody because dramatic responses that you see.
And solid tumors that you've not seen after having done this for...
especially in this chemo-refractory population.
I don't mean to date you, but after having done this for more than a decade, right?
Yeah.